Delirium was one of the first disorders described and was a subject studied by the Greeks. Celsus was the first to write about this disorder in the 1st century. Delirium was first used with the terms lethargy and phrenitis. It was believed to be related to sleep in the 17th century. John Hunter believed delirium was abnormally reduced awareness of the world. Heinroth believed that delirium was an intermediate stage of wakefulness and sleep. Grainer described it as a cloud of consciousness, a point between wakeful and coma. This theory was then used in the DSM-3 as an essential feature of delirium. The DSM-4 replaced the cloud of consciousness with disturbed attention. DSM-5 includes 5 criteria that are specific to delirium. The first is a disturbance in attention and awareness. The second is that the disturbance must develop over a short period of time. The third is that an additional disturbance in cognition must be present. The fourth criteria is that disturbances in the first and third criteria cannot be better explained by any other disorder. The fifth criteria must have evidence that the disturbance is a direct physiological consequence, exposure to toxin, or due to multiple etiologies. The prevalence rate of delirium increases with age and ranges from 14% to 24% when the individual is admitted to a hospital. The most common form of treatment is the antipsychotic drug called haloperidol. This drug has reduced side effects and a reduced chance of causing sedation. This drug can also be taken orally or as an injection. Another less common used form of treatment is electroconvulsive therapy. This treatment includes a series of shocks by electrodes and has eliminated symptoms in previous cases. Isolation therapy could also be used to treat delirium. Isolation therapy includes isolating the patient in a clinical setting, but allows family to visit them. A patient is then treated for all possible ailments to identify a positive cause of delirium. If a loved one is suspected to have delirium, you should take them to a psychiatrist for a proper diagnosis so they can begin the pathway to healing. The biggest key during treatment is lots of family time and to try and avoid hospitalization, as that increases the prevalence rate of delirium. Delirium was one of the first disorders described and was a subject studied by the Greeks. Celsus was the first to write about this disorder.